Welcome to the AOA podcast. My name is Dr. Aaron Brandt, and in this episode, we're going to be discussing changing jobs in early career. I am joined by two great faculty today, both members of the AOA. Dr. Antonia Chen, she is a professor and chair at UT Southwestern for the orthopedic surgery department, a hip and knee surgeon by trade, and Clayton Nuelle, sports medicine associate professor, newly associate professor at the University of Missouri. And today's podcast is focused really on changing jobs, which is not something that we talk about very often, but I have both of these faculty will be able to contribute their views. And please feel free to introduce yourselves and tell me a little bit about your paths and kind of the process that got you to where you are now. Maybe we can start with Dr. Chen.
How long do we have? I'm just kidding.
It's like the little brief because we'll kind of take it from there.
So I started my job at Rothman Institute. I did my fellowship at Rothman Institute and stayed there as an attending. And my first job transition was to Brigham and Women's Hospital in Boston. And then my second job transition just this past September was from Brigham and Women's Hospital down to UT Southwestern. Very different reasons for transitioning and all very different practices.
Yeah, very much so.
Kind of similarly, I did my fellowship at Mizzou, University of Missouri in sports medicine and stayed on as faculty, but in an interesting kind of setup where I was not straight academic faculty. I actually operated and saw patients primarily at an affiliate community hospital. So it was almost more like a hospital employed position in terms of like kind of makeup of the practice and like kind of how the situation was for a couple of years. And then we moved to Texas and I was actually in private practice. I'm in a very big, well-run, physician-owned private practice with physician ownership of surgery centers and all that goes into that for 4 years. And then we moved back to Missouri. And now I am very academic and strictly at academic institution and the mothership, so to speak, if you want to call it that, at an academic practice and a sports medicine practice affiliated with high-level team coverage and all of that sort of thing. And we can get into some of those types of things. But then, so I've kind of gone back and forth from almost really community kind of hospital employed, so to speak, to big private practice now to like straight academic practice.
Yeah. That's a lot. Yeah. As someone who's kind of just getting going and I did just go through my own job transition, it's a lot to process to see that both of you kind of have been moving around. But I guess start from Dr. Chen, maybe. What led to kind of some of those transitions? Was it typically just career advancement? Was it anything in particular?
I think it's a combination of things. I think when it comes to job transitions, you have to look at a few things. One, you have to look at yourself. Two, you have to look at what you want in your life. And three, you have to look at what your surroundings are. I remember starting off at the Rothman Institute, and it was great because I was a fellow there. But it was also, I was a fellow there. And so one of the things I learned quickly is that because you're a fellow at a location and you transition to an attending doesn't mean everyone treats you like an attending. And that's one of those hard transitions to make because, you're familiar with the people. That's really nice. You know exactly where everything is. You know where the bathrooms are. You know, the research team, the clinical team. And I learned a lot from being at Rothman Institute. Obviously, being a private place, I learned the business of medicine. I learned what it would like to open up almost like a surgery center that they did and they started operating out of. So a lot of the important life lessons that I learned about running a practice, becoming busy, building a practice was really good at Rothman Institute. And, when I was at Rothman Institute, it's one of those things where I think most of us don't expect to leave your first job. I didn't expect to leave my first job, to be perfectly honest. I was like, I'm not going to become a statistic. They say, 50% of people leave within the first 3 years. And I became a statistic. So it's just one of those things where my interests were to grow more clinically, and I didn't have that opportunity there. I also wanted to grow more independently in a research fashion, and I didn't have that opportunity there. So, it took some time and I was able to get my legs on my feet. I credit my first job for letting me become more operatively strong, right? Like I, learn how to run an efficient practice, run, multiple rooms, staggering, doing a good job with that and able to take those skills to a different location. But I realized that after 3 years that it wasn't a good fit for me in the long term. But realizing that is a really hard one. You have to be honest with yourself, honest with your surroundings, and also with people that you work with. I mean, these were mentors of mine, right, that I had gone through fellowship with, and to say, hey, I think I should go somewhere else was a tough decision to make. Easier to talk about it now than it was at that time, but everything happens for a reason.
Yeah. I like that. It seems like there's a challenge with that. I think you clearly would have put in plenty of effort to keep those relationships and to build that structure at your location. So I think that was probably very tough. I totally get that, felt the same way about that. Dr. Nuelle, we had talked about just briefly before, how are these jobs coming about, or how are these opportunities coming about? And I think that's also something that everyone wants to kind of figure out. If it's not working, or is there something that's supposed to be better for me out there, even if I'm not looking? What are your thoughts on that, or how did that happen for you?
Yeah, I mean, I think, you start talking about job changing or people changing jobs and stuff. There's really probably kind of two kind of scenarios in general. There's a lot of scenarios, obviously, but two kind of main scenarios. One is I'm not happy where I'm at, or this is not a good situation for me, or I need to do something different. And then another one is maybe, okay, maybe I'm okay here, or maybe I am happy here, but maybe there's potentially a better situation, or maybe I'm even getting recruited to somewhere else. And I could, as Dr. Chen said, maybe I can rise clinically, or maybe I can rise professionally, or, in leadership capacities or things like that. And those can be similar, but they can also be two very separate things. I think the first one is probably encountered a lot more in very early career surgeons. I mean, I think we've all seen the statistics from AAOS. I think it's over 50% of, early career surgeons change after their first jobs, right? Dr. Chen mentioned, I don't want to be a statistic. That's the statistics she's referring to, right? Yeah. And so I think those reasons are probably most commonly because either the people aren't real happy in the first job that they chose for whatever reason that may be, or they think that there's definitely, once they get into practice, they realize their practice is maybe different than what they thought it was going to be, and they realize that there may be a situation that's better for them or better suited for them, or just gives them different opportunity. I think more once you get to mid-career, oftentimes people are pretty established and pretty comfortable in their practice, but there may be an opportunity that launches their career to the next level, or a leadership position elsewhere, or just a general situation where they're being recruited to another institution. So I think those are two separate scenarios, but certainly for the early career surgeon or the early career job, I think people choose their first job out of practice for a ton of different reasons, right? And sometimes those reasons are good ones, and sometimes those reasons may not be as good ones. Certainly we hear when we talk to our residents and fellows and we kind of try and coach them and educate them, we try to educate them that, number one, first and foremost, it's not always just all about the money. I think that's sometimes the elephant in the room, but it needs to be said sometimes, because certainly we all understand people have debt and people have financial issues and things, but sometimes people choose jobs based on solely financial scenarios, and they don't think about their actual practice life, their home life, all of those things that go into that and the actual clinical practice. And then sometimes they get in a situation where maybe it's not super tenable, or their clinical practice isn't what they want, and that's why they changed. But sometimes it's just a scenario where people take the first job that they feel like they can get, and then it doesn't end up being exactly what they thought it was going to be, or going to be promised to them. So I think, there's a lot of different reasons that people change jobs, probably somewhat based on where they are in their career, or where they accept a job, or what the location looks like. But those are a lot of different types of scenarios for sure.
Yeah. Yeah, and this is exactly kind of what the conversations tend to be, just with everybody, is the why. That first job is always hard. And so this is kind of the follow-up to the one that we did with the emerging leaders based on starting practice and doing that. I guess from your perspectives, having changed multiple times, what opportunities, or how do you advise kind of the emerging leaders and those early surgeons to optimize their current situation, to try not to be that kind of I love it, statistic, and kind of give up on the situation that they were in? I think that's important. We want to make sure that we're giving advice to become leaders and to develop practices and to become leaders in our departments, but sometimes it doesn't work. But is anything you take from your prior experience that would help people kind of optimize, advocate for themselves, things like that?
I think there's two sects of thought when we're going through this decision making. One, you're talking about emerging leaders who are looking for a job, and then emerging leaders who are currently in their first job. And we can tackle both of them. If you're looking for a job, Clay really hit it on nail on the head, right? You have to understand why you're taking a job, and then the expectations of the job. One of the things I tell people to do when you're applying for a residency or applying for fellowship is make a list of all the things that you say are non-negotiables that you have to have in a program, and then those things that are negotiable but are nice to have. I say the same thing is true for a job, right? Now, the hard part is we don't always know what we want when we first start out, right? Like when I first started out, I thought I really wanted to do a lot of research. So when they offered me a contract of 2 days clinical and 3 days research, I was like, okay, I can work with that. And then I quickly learned that's not what I want to do for the rest of my life. I really want to do a lot of clinical. I want to operate. I want to be in that setting. So, I took as much call as possible. I was doing cases on nights and weekends. I was able to knock it out of the park, but I had to work at really odd hours to get that because I didn't have dedicated OR time, and I picked up more clinic time, those sorts of things, right? But I had to claw my way to get to that point, and that was not something that I enjoyed doing, I have to admit, right? People like to be, given that time and you can build it and things like that. And so when I went to my next job, I made sure that I had a lot more clinical time, right? It was almost all clinical time. But that was my personal choice. And I didn't know that about myself, right? So when you're starting a job, know thyself as much as possible. Make a list of what are negotiables, non-negotiables. If location is non-negotiable, put that on the list because that will potentially restrict how many places you can go to. Academic versus private, all those sorts of things like that. But there's other things that are non-tangibles that people don't necessarily think about, things like mentorship or having senior partners, or being on an island by yourself versus having other people around. But on the flip side of things, having 20 arthroplasty partners versus, two. Those are things that, I don't really think that I thought of through when I was going through the process. And then in the process of itself, I think when it comes to switching jobs, once you're in that place, how to make it better. Again, go back to that list of negotiables, non-negotiables. Are things changeable, right? Am I able to get mentorship from another attending in the same hospital, even if they're not part of my practice? And if that helps me, then that's good, right? Or, I actually want more research time. I want more admin time or something like that. Can I negotiate that with my practice and get that compensated, right? Is it a work-life balance thing? You're like, well, I'm working on nights and weekends, but I don't have OR time. How can I leverage that and get OR time so that I have dedicated time? So look at your situation and say, what would make me content? Nothing's going to make us happy, but what will make me content in this job? And what can I get feasibly in that? And then what are, again, the non-negotiables that I can attain that are actually really important? And if that's unattainable in your current practice, then maybe you start looking at another practice.
I love that, Antonia. Like, content is such a good word. Like, we want to be optimists and we want to walk in and just have these rose-colored glasses. But I think that in this process and in this career, that's not how it works. And there's always going to be good, there's always going to be bad, and just kind of weighing those options. And I love like your list. I wrote them down like tips, and I would recommend that to everybody, all the early surgeons, really anybody at any stage. Have your list, revisit it, decide what's actually contributing to the challenges that you're doing. Is this a me, or is this something that can't be changed? So I love that. And I think content is, we want to be happy, but content is a great goal. But Clay, I guess follow up on that. I'm sure similar.
I mean, she hit the nail perfectly on the head.
Yeah.
It sounds like we're going to be very similar, Antonia and I, in all of this discussion. But that makes sense with people who have changed multiple jobs and experienced a lot of things now, right? And so, I mean, I think the main tenet is exactly what she said and what you reiterated, Aaron. There is no perfect job, right? I mean, we all like to think there is, but obviously we've all changed jobs a couple of times now, so we can all pretend to that. And truthfully, if somebody at a job that's recruiting you or where you're going to tells you that it is a perfect job or there's nothing wrong with it, honestly, that could be a little bit of a red flag, right? Because everybody knows that nothing is perfect. There's great things about every place. There's not so great things about every place. And every place has its warts regardless of, this or that. It's just a matter of deciding what works best for each person and deciding whether or not those warts are really big and really difficult to deal with, or they're really small and they're just things that happen at every hospital, right? And so there's no perfect job. It's a matter of just trying to find the job that is the best fit overall and the best way that you possibly can. And you used a great word with content. And Antonio made a great point that we tell our fellows and residents too. We call it a Franklin T. That's kind of like the old school method of what it is, right? But it's the exact same thing. Pertinent positives, pertinent negatives. We're all used to that in medical lexicon. And so what are the things that and I even tell our folks to even stratify at another level even more. So it's things that you absolutely have to have, things that you would like to have, things that you absolutely do not want, no matter what, and then things that you think you probably don't want, but you could probably deal with. So it's actually even kind of stratified into 4 categories. And the absolute must-haves and the absolute don't wants, those are absolutes, right? And she mentioned one. Maybe one is location for one or the other in either of those categories, right? Whether you want to live in a big city or you don't want to live in a big city, for example, or something like that, or your family does or doesn't. And then there's a whole lot of the like, I would like to have, and then I don't think I want, or I don't think I would like to have. And she mentioned one for herself in terms of research starting out and then that changing. And the ones in the middle, the likes and don't likes, those usually can change over time, or those may change as you get into practice or as you get into a practice. The absolutes usually don't change or don't move one way or another a whole lot. So you can start with those, and that narrows your scope down quite a bit potentially for some people from the start. And then you start getting into the likes and wants and don't likes. And then you can really kind of start to tease things out and narrow things down even more based on those individual factors.
I love that. Yeah, no, I think that, and those factors all change. I think that's the other thing, that just be flexible, because there are things that you think that you want and need that can change as you work through things. So that's part of kind of growing and developing. I tell people that with even residency applications, that like, if you're seeing smoke, get out the fan. Like you got to start asking the questions and pushing those buttons, because it's not perfect. So
I like that. I like that term. I'm going to start using that, Aaron.
It's need smoke, get the fan out. I like it.
I'm full of them. I'm full of them. Awesome. Well, the other things that kind of come up with these conversations is kind of like, how do I find opportunities if I am starting to look? Did either of you have that, like, to where you saw the writing on the wall and just were looking for this next layer? Or I think both of your situations sounded a lot of kind of progression and good reasons, but any of the not so good reasons?
So, when I say leaving a job, I would look at the push and the pull. Are you being pushed to something, or are you being pulled to something else, right? And in an ideal world, everything's a pull, right? Oh, this next opportunity is great. This is where I want it. But in reality, a lot of time is push, or a combination of the push and the pull. I was fortunate in that when I was at my first job, someone had reached out to me at Brigham and said, are you interested in a position here? And at the beginning, I was like, no, I'm actually pretty happy here. But it depends what you quantify as happiness. I think from a push perspective, it was one of those things where I was one of many different arthroplasty surgeons, and where I was pretty saturated with arthroplasty surgeons. So that made it not the greatest in the world. It also was one of the opportunities where, again, I had envisioned myself doing more of the clinical work and more of the research work in that realm, and it didn't feel like I could achieve what I wanted to achieve, I said, for lack of a better term. So from a push perspective, it was one of those things where I was not necessarily getting the same support that I thought I would be getting, and versus where I was getting a pull from somewhere else. They're like, hey, why don't you come up here and run our arthroplasty research, for example? And again, from an academic standpoint, that was a really cool opportunity. Now, it's because no one wanted to do it. But that said, it was something that was neat that I could make it my own. So the first time I was asked to go interview at the Brigham, where I ended up going to, I was like, I'll check it out. And so I checked it out, and I didn't end up going there. And the second time I checked it out, the question I got asked was, this is like a guy asking a girl out for a prom date. Like, are you gonna say no to me twice? I was like, well, the timing wasn't right, and that's the first time I checked was a year and a half into practice. And at that point in time, like that boards collection time frame, that's like, one of those things where it just wasn't a good time to move. And so, the one thing I do recommend for anyone is it can't hurt to check out other job opportunities, right? Even if you're not necessarily interested in it at that time, it can't hurt to look at them. So there's, some not net positive things, and there's some, from being the push, and then there's positive things from the pull. And I had to start from scratch, right? I had to develop a name again. No one knew me, right? And so to work and take that process, I warn people that takes, depending on the practice you walk into, if something's not well established for you ahead of time, let's say someone's retiring and giving it to you, that's 3 to 5 years. So you can't expect to walk in and say like, hey, I'm going to have exactly what I had before my splash practice and my new practice now. So there are some downsides to it, but just recognizing which draws you more. Is it the pull that's driving you more, or is the push, or the combination? Either way, then it's a sign, I'd say.
Yeah, I like that. Clay, thoughts?
Yeah, I mean, I think, Antonio mentioned something earlier that I think is really vital and can help when it comes to like changing jobs or looking into changing jobs, and that's mentorship and leaning on mentors. Obviously that's one thing that I think the AOA does a great job of, is developing these mentorship programs. And I would encourage everyone in the AOA to get involved in some sort of the mentorship programs or the different types of things. Or if you attend the AOA meeting, attend some of the talks or some of the symposiums that the AOA does on mentorship, because it's huge and it can benefit you in so many different ways. One of which is what we're talking about with connections, or having people that have connections that can help you. And so just a brief example for me. So the reason we moved to Texas is because my wife was military. And so she had a service commitment to the United States Air Force, where she's going to be a hand and microvascular surgeon for 4 years in the United States Air Force in San Antonio, Texas, and I was going with her. I wasn't staying behind with a family and everything else, but that meant I had to find a job in San Antonio, Texas. And so, we knew nothing about San Antonio, Texas. We'd never even been there before. So I reached out to a couple of my mentors, one of which was one of my fellowship directors. And I said, hey, you know anybody in San Antonio that like would be willing to maybe hire a guy? And sure enough, he was really good friends with Steve Burkhart, which is a name that anybody that's done shoulder surgery probably knows pretty well or read the books and stuff. And he linked me up with him and said, this guy's a great guy. You got to interview him. You got to talk to him. You got to take him, all this kind of stuff, that mentors do for you. And then sure enough, after meeting with him a couple of times, it worked out really well. And so I was fortunate to link up that way, but it really went and that simply is that, one of my mentors talked to one of his good friends who then kind of linked us all up together and made it all work. And it ended up being a great opportunity in a private practice in Texas. And so I would just say, leaning on mentors or trying to develop those relationships or utilize your mentors or your connections that you have through organizations like AOA and things like that could really help you, guide the job search or guide, to certain positions that trusted people can give you better information about.
Yeah. Yeah. And that's something that I've noticed through the process is that, and I'm going to throw out what may seem like random comments through this conversation, but authenticity and being authentic as a person throughout this process, no matter what you're doing, is huge, because that's when the opportunities really do come. So those mentors, those sponsors, those people are going to be able to advocate for you better or help you find those spots if you know at least a little bit of what you want and who you are. And so that's why I've enjoyed kind of hearing your guys' paths, because it seems like regardless of whether it was a push or a pull, these opportunities came or these changes came because of those things as well. And that's for me, I just made that change myself. It wasn't that I was necessarily looking. It wasn't quite the right situation, but I have been very lucky to have great, wonderful sponsors and people who have advocated and pulled, which has been helpful for me, because I'm going to be the first to admit, I don't know what I want. I know a little bit of what I don't want. And so that's kind of how have made decisions. So that's part of the process. I want to kind of work into the process of leaving. And these are the hard conversations. And Antonia, you're now chair. I'm sure you've had to have these conversations, and we've had them a few times now. But how do we have these conversations and do it without hurting our situation where we're at, and doing it the right way, I guess, if there is a right way?
So everyone has a different path. I would actually add something to the whole mentorship and people idea. This is a topic that people don't talk about. I remember when I was looking for a new job and leaving, I felt like a pariah.
Yeah.
I didn't feel like there was no one opened up about it. Again, where I was coming from, everyone was like, well, no one leaves the Rothman Institute. And you're like, wait a second, but if I leave, then am I weird? What's wrong with me? Things like that. So
I hope you find what you're looking for, is what I kept hearing. I'm like, oh my God.
Find yourself.
Yeah.
It's a millennial topic. It's one of the things, but the discussions are hard. So there's a few ways to look at this. So I think it depends on the reason why you're leaving, right? So before leaving my first job, it was a discussion of the people there saying, hey, these are the things that I'd want. Is it possible to achieve these? More clinical time or whatever. And if they can't deliver that, then when you look for another opportunity to present another opportunity to them, it's not a surprise, right? You've been asking this for a period of time. They can't fulfill it, and for whatever variety of reasons. And if they can't fulfill it, then you have to seek somewhere else to accomplish that. On the flip side, when I was leaving Brigham, I had some job interviews and all the job opportunities. I was very upfront with my chair very early on. I was like, hey, I'm interviewing at these other places. This is what I'm looking for. Are these things that I can achieve here? So for example, I wanted to be chief of arthroplasty, just to really get the leadership opportunities there, to understand what it's like, and to really help change the needle of what we did in arthroplasty at Brigham. And after some time, my chair, to his credit, gave it to me, which was really nice. And he goes, what can we do to keep you here? Or what can we do to, advance your career here? And every time I brought up something, sometimes they could do it, sometimes they couldn't, right? And I had to ask myself, is this enough of a needle to move me to move somewhere else or not move somewhere else? But I think the worst thing to do is to be clandestine and not be upfront with your leadership and interview at jobs, then all of a sudden spring a job at them, or say, oh, I'm going to this job opportunity because I couldn't have that here. And they're like, well, I didn't know you had all these concerns or questions and things like that. So communicating early, I think, is one thing. And then communicating their patients is another thing. That's always a tough one. After establishing a practice for a period of time, it's always tough to leave them, tough to leave the people that you've worked with. But again, as long as you're upfront as to why you're doing it, and what are you going to? So here was a big pool, right? I got to become chair of a department, which is a pretty cool pool. So less of a push, really not much of a push there, but much more of a pull here. But again, and then there's some things that I did say to my chair. I'm like, well, here's are the few things that I would want to be able to change, and some things are not changeable, as we know from a systems perspective. So no matter as much as my chair would love to be able to do so, that's not necessarily a feasible thing. So being honest with people you work with so that nothing's a surprise is a nice thing, I think.
Yeah.
I love that you gave your first spot at Rothman the opportunity to meet you at your goals and expectations, or at least you set those expectations and you gave them things that you were looking for to further your career. And at least you gave them the opportunity to do that. At least it sounds like it. And that sometimes that may be feasible and sometimes may not. And that's okay, right? If certain places that you just said can't meet you at those things, but you at least gave them that opportunity, because then when those opportunities did arise for you elsewhere, like you said, they couldn't be surprised when you went to then go take those opportunities. I love that.
Yeah, makes sense. But one of those things where you have to be honest with yourself and then honest with them, and that's not a fun conversation
Yeah.
either. How about for you, Clay?
So if I could, if I think the first thing I always say is, if you're thinking about leaving or even looking into leaving, number one, and we say it all the time and it seems basic, but it's so true. And obviously we've all heard the horror stories. Don't burn any bridges anywhere, anytime. Like, it's easy to say, it's a lot harder to do, especially if you're going to take a new job, or if you know you're going to go somewhere else, or if you even really don't like where you're at. Like, don't burn bridges. Like, this is a small world. It's a small community, no matter what subspecialty you're in, whatever. Like, just don't burn bridges anywhere you are, even if somebody wronged you. Like, just take the high road 100% of the time. It's a lot easier said than done for all of us, of course, but like, just try and keep repeating that mantra to yourself before, during, and after a job search or a job leave. If I could get slightly more granular, I won't dive too far into the weeds, but I think one of the things that's important is, before you even sign a contract, whether it even be your first contract or when you're looking for a next contract, you do have to ask some of the hard questions ahead of time. And some of the things as simple as, like, if I were to leave, what does my tail insurance look like? Who pays for it? Do I have to pay for it? Does the department or the institution or the group pay for it? What about a signing bonus that I may or may not have received? What about some of the compensation? What about some of the trailing collections? Who gets that, or does it still come? And so those are maybe a little bit more granular things that may be beyond the scope of this particular general conversation. But those are hard questions to ask when you're negotiating with a new job or a new place, right? Because you don't want to give the idea of, I'm already looking for my out before I even sign or before I even join the place. But they're important things because, again, as we've stated, the statistics, half of people are going to leave. And so, like, you need to plan ahead for the just in case. It's just like getting life insurance or disability insurance, right? Like, we all hope that none of us ever have to use or need any of that, but somebody's going to. Some of us are going to. Someone's going to need to. So you got to have it, right? And so you really got to, like, get down, fine tune all those granular details of some of those specific things ahead of time to prepare yourself, if and when you do leave or you do need to leave, that all those things are lined out and written and in contract form well ahead of time.
Yeah. Yeah. That's not completely part of this, but it is. I mean, these are part of having the conversations, is being prepared to have these conversations. And you don't want to go into it with looking for the out, but this part of the job. It's something that I felt awful trying to go and have these conversations with my chair. It was someone that I, like, still to this day consider a game changer for me, not just mentor, but a kind of that next level, if you will. So I, like you said, I was very upfront with him from the start. I got mixed information on kind of how to approach that. Some people were like, you don't have to talk to anybody. You can just kind of explore and see. But to me, it just didn't feel truthful. And so, again, just going back to just not burning bridges in the way that I wanted to be perceived. Like, is it me to kind of go behind the back and look for jobs, or do I want to kind of be upfront and go through the process with them? It also gave me the opportunity to talk about the things that I was having trouble with, and that conversation needs to be ongoing. It's part of optimizing that first job and optimizing your situation. And I'm not the best at that, and we're still working on it, but learned a lot from the first process. So I love that. Yeah, I think that's important. That first contract or that second contract, whatever contract you're in, being comfortable and safe in your job is great. It takes a lot of pressure off of you too, as far as just kind of focusing on the work.
How do you like what something that Clay said? And I really do like to emphasize, like, don't burn bridges.
Yes.
And don't burn bridges from residency, don't burn bridges from med school, don't burn bridges from fellowship. I ended up my job at Brigham because my chair was my residency attending, and that's crazy how small of a world we had, right? Clay's back to, it's right. Like there's reasons that things happen. And if you had burned bridges, then it'd be a very different discussion. Orthopedics is a very small world. Private, academic, doesn't matter what it is. It's a small world. So don't piss people off, and I mean, there's obviously reasons and when to, obviously not to burn bridges, but to bring things to light that are wrong. But to have, because I didn't get this one little thing that I really wanted, this not something to be petty about. So I really
Yeah,
like it.
that's a great point. I mean, there's ways to be helpful and constructive for places too, right? Like there were things that I didn't like in my last practice, but I wasn't just like, this is dumb, this is stupid, you guys stink for having it this way or making me do this for the last 4 years. I said, hey, like this is a situation, this is something that's kind of difficult. This is not why I'm leaving. I'm leaving for different reasons, but this is something you guys may want to look at as a group moving forward, or this is something that could, potentially be an opportunity to improve. And they took that to heart. Like they took what I said, I had an exit interview with a bunch of the folks in the group, and I said, this is all the things that I love about this place. You guys are doing awesome in so many ways. Here's a few things that, were difficult for me while I was here and that could be better. And they since changed almost every single one of those things for the new partners that they've added. And it's made it a better opportunity for the surgeons that have come behind me. And I still have great relationships with all those people, I think at least in part because of that, because they feel like they've gotten better in some respects just from learning and from some of those constructive parameters that, that I gave them before even leaving.
Awesome. Yeah, I think that's incredibly important. And to that end, I went to medical school here in New York and did not want to stay for residency, which many people would be like, "Oh, like there's no way they would ever bring you back," But that's kind of how this opportunity came back, was mentors and sponsors who recalled that, even with me being like, I really don't want to be here. Coming back and asking that question, I thought was pretty cool. So just to follow up on those points of the not burning those bridges, keep things open and have kind of truthful conversations. But we're running a little bit low on time. I think this has been exactly what I think people need to hear and people should talk about. Hopefully it will kind of lead to more conversations and more openness about these discussions, because it is a real thing, a real common thing. Definitely not advocating for job change, but it's part of the career, part of the process. I guess any kind of closing words of wisdom from you guys before we sign off?
Reach out anytime is what I would say. We've gone through it. You'll be surprised at how many people have gone through the process of changing jobs. And if one person can't relate to the reason why you're changing a job, find someone else. Everyone has different reasons for it. And maybe your mentor for something is not your mentor for changing your job. And that's okay. It's okay to have mentors in multiple different spots. I like what Clay said about having your mentorship, leaning on people. The AOA is a great foundation for that. There's multiple different ways that you can do that. And so finding your people to talk to it that you can be candid with and honest with, and to get a really good assessment of whether or not you should leave, what you should leave for, and if the opportunity is really the reason to leave. Those are important things to have.
I always tell our folks, don't be afraid to ask for anything, or within scope of reason, of course, but don't be afraid. The worst that any place or any new place or any different place, the worst thing that can happen is they say no, or no, we just can't do that here. But don't be, I think when people are looking for jobs, especially their first job, but even their second job, like people are afraid to ask for something or afraid to negotiate something because they're like, oh, I don't want to come across as a greedy person, or I don't know if they would even be able to do it. Like the worst thing that can happen is they say, we can't do that. Like, right. Like, so don't be afraid to ask. And if you don't ask, you may never even have the chance to get it, right? This is what I always tell our fellows and residents. Like, if you really want something, or even if you think you want something, but you don't ask, they're probably not just going to come out and give it to you, or just come out and say, oh, well, how about we give you this extra day of OR time? Or how about we give you this or that, right? Or how about we give you just 2 academic days of paid time? Whatever it may be, you can name the situation. So like, don't be afraid to ask for things, and don't be afraid to seek out things. And you'll be surprised that more often than not, they may be able to accommodate you, or maybe something else may not work quite as well, but they accommodate you for what the ask is, or what the ask was. And especially if you are changing jobs, it's important to think about the fact that like you're in a little bit different situation than when you're just coming out of training, right? Like when you're first coming out of training, a lot of people are just hoping to get a good job, right? Once you've been in practice, especially if you've been in practice for a few years, or especially if you're board certified, or especially if, you've established yourself in research space or academic space or clinical volume, whatever it may be. Now you hold a few more cards a little bit, right? Like you've established yourself as a quality surgeon, hopefully, or whatever in different places. And so you hold a little bit more cards and a little bit more sway. And so your negotiating power is a little bit better. Not that, again, that it's all about negotiating power. It should be about finding the best opportunity and the best fit for you. But, don't be afraid to ask for things. And if a place is looking at you once you've been in practice for a few years already, it's probably because they have a need and because they want you, hopefully and potentially in many cases. So don't be afraid to like kind of push the envelope a little bit. Again, within reason. Like we said before, you don't want to be a jerk to anybody or anything, but like don't be afraid to ask for things and push the envelope.
Awesome. Yeah, I mean, that's perfect. You even kind of reference back to that starting practice. You definitely have to optimize and do your best in that first job. Like if it turns into your career job, wonderful, but it still is going to affect the process moving forward. So just taking advantage of that, optimizing. And then I love it. I think that asking those questions, utilizing programs like the AOA is huge. It's leaders, it's people all over the country that want to help and want to be a part of that process and want to have conversations like this. Like what other organization is going to breach subjects like this openly? So utilize those resources, join the AOA, become an emerging leader, kind of all these different things, because you're going to have these networks to work from. I wrote down so much stuff for myself from you guys today. This was an awesome discussion. I think it's really going to be helpful to people. So thank you both for your time. Please look out for the next recordings, the next episodes of the Emerging Leader podcast. And if this is the first one you're kind of listening to, we have one on starting practice earlier, as well as a couple others in queue. So thank you again for your time. This was wonderful. And I'll see you at the next meeting.
Thanks so much for organizing this, Aaron.
Oh, yeah.
Thank you very much, Aaron. Thanks for inviting us. Appreciate it.
Yeah. Thank you.